Welcome back, everybody. This is Dr. Elsie Coe, CEO and founder of Lead Physician, an online course for physicians, empowering them to learn leadership skills to really lead the field. I'm back here today with Dr. Win Hammerly. He goes by Win. His name on LinkedIn, I believe, is Milton. Thank you, Win, for coming today.
Glad to be here.
The reason why I asked Win to come back, he is an expert in negotiations and dispute resolution. He has a long history of having leadership administrative roles as well as clinical work, and he has an extra degree. So Win, can you help us to learn some special skills, some little secrets that you know to help us be better negotiators? Tell us one of the common mistakes that we make as physicians or healthcare workers, healthcare administrators in negotiating.
Sure. Well, the most common, I think, is assuming that it's a win-lose, that it's a fix-sum pie type of scenario, when in fact, it could be a bigger pie. It could be a win-win that is advantageous for both.
That's so true.
So along with that kind of first mistake is not understanding what the other party wants. And how can you help them actually achieve that? Rather than first and foremost coming with your ask, it's really understanding how can you help advance their goals, and in the process they are going to be more open to what you're interested in.
That's right. Can you give us an example of where things went awry? I'm sure you've seen a lot of that. And then what did you do to fix it?
Say it's a raise, and you don't think about what the administrator has to do to where else they're going to have to make a cut to allow that to be possible. And how is this going to help advance their what they're trying to accomplish? So really, you have to take a step back, understand, are they trying to increase patient throughput? Are they trying to decrease length of stay? Are they trying to decrease expenses associated with hospitalizations or clinic visits? If that's what the person you're asking wants, then how will you help them achieve that? How will, or say it's not a raise, it's a scribe. You're spending so much time in the EHR that you're pulling your hair out, and you've read the studies, you've seen the research that a scribe not only helps cut down on that time, but it actually helps you see more patients. And so the salary of the scribe more than pays for itself by more clinic visits. And so again, just asking for it without understanding how that can help them is short-sighted. You really need to think about it being a win-win. And essentially what happens then is it does become a bigger pie. They're not having to cut somewhere else to accommodate what you want. It's an investment that's worthwhile.
Right. So putting it in terms of their language,
right,
from their point of view, and it would be a win-win in that situation. That's so good. This is would you say this is a skill that anyone can learn, or is it some, it sounds like a work of art, you know? It sounds like you have to learn these special skills in order to get there.
Anyone can do it. It just takes practice and the willingness to do it. And you know, along the way, like with any skill, you make some missteps and you say, oh, well, I'll do better this next time this way. And so yeah, it's like any other skill. Another in with that is making the mistake of not finding something to agree on. And again, if you understand what they're trying to accomplish and you're on the same team, it shouldn't be fine to help to find those things. It shouldn't be hard, sorry. It shouldn't be hard to find those things that you can agree on and that you can move together towards. The other mistake is, and this happens to all of us, when things aren't going our way, we tend to get a bit agitated. We get emotional, and that's normal. And so, in terms of dealing with that, you know, the common saying in a code, first thing is check your own pulse.
That's so true.
And so when you realize, when you're self-aware that you are starting, your heart's racing, that you're, that you're getting a bit agitated, take a breath, count to 10, or if you're really upset, as I think
Walk
it was
away.
Andrew, yeah, count to 100. No, but understanding that's happening is the awareness is the first step. And so it's very important to not allow that to get in the way of a negotiation. And you can use humor, you can use delaying tactics, there's all kinds of things you can use, but the first thing is being aware of it.
Yeah, there's all these tactics that people talk about. I mean, mirroring and reiterating what the other person's saying, basically, or calling out the emotion that the other person's saying. What do you think about all those tactics? Do they work?
Well, they're good, and again, to some extent, they're a bit of a delaying tactic. It's good to name it and to put it out there, to whether it's the emotion, yours or theirs, and that in and of itself can help defuse things a little bit. But it's a bit of a delaying tactic. And classically, we're in the it's election day, and we've dealt with nothing but politics for some time. But as you look at politicians, they use delaying tactics all the time, and they'll say, "Well, that's an excellent question. That's an excellent point. That's and so that gives them time to formulate what they're going to say next. And so it's not only helpful in terms of the other person feeling heard and the other person being able to relate more to you if you're feeling, agitated or anxious or whatever it is. But it also gives you time to, because you'd like to have the right words always at the tip of your tongue, but sometimes it takes a bit of a delay for that to happen.
Right. Sometimes delay is good because that helps you to calm down, right. And then it helps you to listen more and give that other person a chance to talk. Without that person feeling like they had a chance to even speak or be heard, you're not going to gain any kind of trust, or you're not going to set the groundwork for negotiation. So that's really good. And you know what? I did speak to a doctor once who said that when he was trying back in the day to change the old radiology films to digital, and right. wanted to convince the CEO that was the right move to make, he had to go the extra mile. You can't just, as a physician, go there and say, well, this is going to improve the quality of care. The patient's going to get less radiation, and I'm going to be able to see the clearer picture, and I'm going to be able to make the diagnosis better. Although those are great reasons, especially from a clinical standpoint, quality of care. And, as a clinician, I would say, of course, we need that. But you're going to buy this like millions of dollars of equipment that's, that they didn't have before. And why can't we just keep with the old way? And he said what he had to do was look at the finances and really calculate out, estimate, in your best estimate, how much does it cost for a radiology tech to spend, to produce one film? How many films can they do in an hour? How many can they do it with digital film? What does that do to cut down labor cost? And what is the efficiency that's gained? Like, where can that person can then use their time to do other things? And what does that mean for the overall cost of the system, and how long will it take to pay this back? So all of that made it such a difference. And okay, I see what you're saying. I get it, because now you're speaking their language. It's like, the 5 love languages of that book that was written. I think this is the same concept, is understanding what is the language of the other person that you're speaking to.
And it's not only the language, but it's also making it very objective and measurable.
Yes.
In the example that you were giving. Yeah. And so if you can objectively, measurably show how an investment in what you're asking for is going to pay off multiple fold, it's going to have a positive ROI, that becomes a different conversation. And again, the language of ROI is also, from a negotiation perspective, is the language of a bigger pie. It's not the fixed sum game. It's not, you're going to have to sacrifice somewhere else. It is, doing this will make the pie bigger. It advances both of our goals in common. And it really is a different conversation.
Right. And there's also, I think, and what do you think about this? It's also a matter of trying to think about, what can I do without? How can I compromise? Do I have to have every single ask that I'm coming here for? And what is my, what are the top, what's the top 1, 2, and 3 by rank that I want here? And what can I live without when I walk out here before I get into the room, so that I'm prepared to say, this, I can't do this. I have to walk away, or yes, I can, let's compromise and I can deal with not having this one piece.
And asking for several things and having some things that you can give away, and then meeting somewhere in the middle is also a classic negotiation tactic. And then as you kind of alluded to, this, what's your walk away point? If I can't get this, then, or in technical jargon, they call it the best alternative to negotiated agreement, the BATNA. But if it comes to that, you have to know what your alternative is, what's your viable alternative.
Right.
And so I don't think that it's good to just have a fixation on one thing. You can have several things on the table and prioritize what's most important. The other thing in terms of flexibility that I think is valuable is to say, well, if it's not this, say you're talking about salary, then could it be time off? Could it be contribution to the retirement plan? Could it be something else other than salary? So sometimes if you'll accomplish the same thing, but you can do it in different ways.
Yes, that's right. That's good. So just as we conclude here, when these are so good, everyone can learn how to do this. You've gotten a degree in it, which I think is so special. What are the top 3 secrets or things that you think you can give us when we learn to be better at negotiating? Whether you're a physician going to administrator, or your administrator going to a physician group to gain influence and to negotiate for something that we need to change, or we need to do that's different.
Sure. Well, I would say find something you can agree on. And that's a good starting point. The next step is help me help you. And in order to be able to do that, you have to understand what it is they want. So you have to listen and not start with what you want, but what is it they want? Help me help you do that. And so I think that's critical. And then take your pulse. Be self-aware.
Be self-aware. Yep. So true.
Because it's so easy. It's so easy to get caught up in things to kind of unwind if you don't do that. And the last thing I would say is, whenever possible, make it very objective and measurable. And not that it's going to be a Spock conversation, that it's going to be purely abstract and intellectual. But if you don't have the data internally in your organization to support that, you can certainly look outside. But ideally, if you've got examples within the organization, that's actually even stronger.
Great, thank you so much. Every time I talk to you, I learn something new. And I just want to say, I'm so grateful to have you as part of our team, teaching our physicians on Lead Physician. We're doing some role playing on negotiation in a couple weeks. So I'm really looking forward to that. If you're interested in being on this podcast to help physicians and other healthcare leaders learn some techniques in leadership, please reach out to me at info@drelsieco.com. We are starting a new leadership course round coming up, so you can look us up at leadphysician.org for individuals and organization. Thank you. And how can people reach out to you if they want to learn more about negotiating skills?
Thanks,
and
Elsie.
your services?
Yeah, LinkedIn is the best way to reach out to me.
Okay, we will put a little banner from your LinkedIn profile. All right, Wen, thank you. Have a great day, and thanks so much for being on with us again.
Take care.
Take care.